Hi, I'm Dr. Caitlin Costello, Associate Clinical Professor of Medicine at Moores Cancer Center, University of California, San Diego. I'll be discussing our recent article entitled Insight a large, global, prospective, non-interventional, real-world study of patients with multiple myeloma. Multiple myeloma is a type of cancer affecting the plasma cells in the bone marrow. Over the past 15 to 20 years, several new classes of medications have been developed and approved for the treatment of multiple myeloma. With 12 new therapies either approved or in late stages of clinical development, we have seen improved patient outcomes and longer survival. Several of these therapies have a tolerable safety profile that allows for the use of maintenance or continuous therapy approaches, which have also resulted in improved patient outcomes. However, there is no global standard of care for multiple myeloma patients. The approval of and access to these new therapies varies across the globe, and as a result, the treatment guidelines and regimens that are prescribed vary from region to region and country to country. This leaves physicians with the challenging question of how best to combine and sequence therapies to meet the unique needs of each patient, with the goal of providing optimal treatment and outcomes for each patient. As a result, there is substantial variation in treatment approaches for patients worldwide. Understanding these variations is critical. Real-world data on the use of anti-myeloma agents in routine clinical practice are emerging. This is one of the most important tools we have to help us better understand these regional variations in prescribing practices and their impact on patient outcomes. Real-world data are suggesting that the efficacy improvements seen in randomized clinical trials are not always carried over into the real-world setting. In fact, several reports indicate that less than half of real-world patients would meet inclusion criteria for a phase 3 clinical trial. Therefore, the results from these clinical trials are unlikely to be achieved when these same regimens are prescribed in unselected patient populations as part of routine clinical practice. Currently, real-world data on multiple myeloma disease presentation, treatment patterns, and outcomes at a global level are limited. Insight is the first truly global, prospective, observational study of multiple myeloma conducted to date. It aims to bridge the gap in the understanding of the efficacy of anti-myeloma agents in clinical trials and their effectiveness in real-world settings. With this study, we aim to gain a better understanding of contemporary, real-world patterns of patient and disease characteristics at diagnosis and relapse, treatment choices, and patient outcomes. The key study assessments we are interested in include patient demographics, clinical disease presentation and medical history, disease management, including therapies chosen and treatment sequence, as well as treatment outcomes, including response, treatment duration, time to next therapy, progression-free and overall survival, and safety. Capturing the patient's perspective has been incorporated into the design of the study through the use of validated patient-reported outcome instruments, PROs. Through the patients completing these PROs at baseline and then quarterly, we hope to better understand the impact of multiple myeloma and the treatments used on the patient's quality of life. The specific instruments that are being used include the EORTC Quality of Life Questionnaire, Core 30 module, and 20-item multiple myeloma module, a single item on peripheral neuropathy, and the 9-item Treatment Satisfaction Questionnaire for medication, which covers treatment effectiveness, convenience, and global satisfaction. In addition, data are being collected to allow for a better understanding of the healthcare resource utilization required to care for multiple myeloma patients. We are actively enrolling in 15 countries and targeting approximately 4,200 adult patients with newly diagnosed multiple myeloma within 3 months of treatment initiation, or patients with relapse refractory disease who have received 1 to 3 prior therapies. This is a non-interventional study, therefore no study drugs are being provided. Patients are being enrolled over a period of approximately 3 years and will be followed up prospectively for a minimum of 5 years. A global steering committee comprising 20 multiple myeloma specialists and 2 patient representatives is overseeing the conduct of the study. Several data analyses have been reported to date that highlight marked regional differences in real-world treatment patterns in both newly diagnosed and relapse refractory multiple myeloma patients worldwide. Possible explanations for this could be variations in drug availability, treatment guidelines, and different prescribing practices at academic versus community treatment centers. Outcome results will be forthcoming when longer follow-up data are available. Ultimately, the final findings of this study will provide comprehensive insights into patient and disease characteristics, treatment patterns, and the outcomes associated with contemporary treatment approaches for multiple myeloma in real-world settings, and will help us understand the factors contributing to the gap between clinical trial efficacy and real-world effectiveness in multiple myeloma. Thank you.